The appendix is a finger-shaped tube 3.5 inches long, extending from the right side of the large intestine. The exact function of this organ is not very clear. Appendicitis is a condition in which the appendix becomes inflamed and filled with pus. It is a medical emergency requiring immediate surgical removal of the appendix. If it is left untreated, there are chances the appendix will burst, spreading the infectious material into the abdominal cavity, peritoneum. This can inflame the abdominal cavity, a condition called peritonitis, and can sometimes be fatal if not treated urgently. Appendicitis can strike at any age, but is common between the ages of 10 and 30 years. Causes. The causes of appendicitis can include obstruction of the appendix cavity by fecal stone, hard piece of stool, food waste or tumor, gastrointestinal infections, inflammations. These can cause the bacteria naturally present in the appendix to rapidly multiply, leading to inflammation and infection. Signs and symptoms. The signs and symptoms of appendicitis include mild pain in upper abdomen and belly button region that increases to sharp pain as it moves into the lower right abdomen. Rebound tenderness. When pressure is applied to the painful area and then released, the pain increases. Pain with coughing or walking. Abdominal swelling and cramps. Loss of appetite. Nausea and vomiting. Bloating. Low-grade fever. Painful urination, constipation, or diarrhea. Diagnosis. It is difficult to diagnose appendicitis as the symptoms are similar to other health problems. Your doctor will examine your symptoms and conduct a physical examination of your abdomen. Diagnostic tests include blood tests to check for high white blood cell count, urine test to exclude urinary tract infection or a kidney stone, imaging tests including abdominal X-ray, ultrasound, or computerized tomography, CT scan, rectal examination. Treatment. Surgery is the standard treatment for appendicitis. Antibiotics are often given before surgery. Your doctor will perform the surgery under general anesthesia. The surgical technique for removal of the inflamed appendix will depend on you and your surgeon's preference and whether the appendix is ruptured. The surgical techniques include laparoscopic appendectomy. Your surgeon will make small incisions in the abdomen and insert a laparoscope and other tiny instruments through them. The laparoscope has a lighted camera which will help your surgeon view the operation site on a large monitor. A gas will be pumped in to separate the abdominal walls from the other organs and allow better visibility. Your surgeon will then remove the appendix. Laparoscopic surgery will allow you to recover faster with fewer scars. However, if the appendix is ruptured and the infection has spread, you may have to undergo open appendectomy, which will allow your surgeon to thoroughly cleanse the abdominal cavity of any infectious material. Open appendectomy. Your surgeon will perform an open surgery through an incision of 2 to 4 inches on the abdomen and remove the appendix. If a rupture has occurred, the peritoneal cavity will be thoroughly irrigated to remove any pus. Appendicitis is a condition where the appendix becomes inflamed and infected, requiring immediate surgical removal. You should consult your doctor if you experience symptoms of appendicitis in order to prevent life-threatening conditions caused due to a ruptured appendix.